You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Dahlman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a mother-to-baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at mothertobaby.org. Welcome to another episode of the Mother to Baby podcast. My name is Chris Dahlman, and I am a genetic counselor, a mother of four, and a teratogen information specialist. So what that means is I talk to people, patients, providers, and family members about exposures before and during pregnancy, during breastfeeding, and in cases of adoption. And exposures can be anything. So it could be hair dye, it could be a medication, a vaccine, or an illness. Today, we have a very special guest, Dr. Lashe Ajayi, who is a board-certified pediatrician and fellowship-trained palliative care physician. She serves as the Director of Clinical Research and Diversity Initiatives at Scripps Research Translational Institute and as an Assistant Professor of Pediatrics at UC San Diego and Rady Children's Hospital, San Diego. Dr. Ajayi, thank you so much for being with us today.
It is such a pleasure to be here, and I'm so excited. And after hearing your intro, I'll also add that I am a mother of 3 children.
Excellent. Thank you for sharing. So what is your ratio? How many males? How many females?
Absolutely. So I have a son who we actually adopted from South Korea. He just turned 13 years old today. And then I have 2 that I gave birth to. One is a 5-year-old girl and a very rambunctious 20-month-old.
Wow. Well, happy birthday to your oldest. Wow, 13 today.
Yes.
I do not need to warn you, I'm sure, about teenagers. That is not the focus of this podcast. So, we are very lucky and grateful to have you because we are going to talk about something very interesting called PowerMom. So can you give our audience some information?
Absolutely. So PowerMom is a mobile research platform that really looks to engage pregnant people from across the United States. And I say a mobile research platform because it allows all pregnant people and those who've recently given birth within 8 months of giving birth, 8 weeks of giving birth, to participate in clinical research without having to leave their home, and can really participate as long as they have a smartphone device or have access to the internet. It really combines kind of those survey questions, the information that you would give to your healthcare provider when you went to go get prenatal checks or postpartum checks, and is actually able to incorporate wireless device information. So many of us moms are wearing Fitbit, some kind of fitness tracker, or we collect steps from our phones. So it really combines that kind of passive information from patient-reported outcomes together in one research platform that allows moms to kind of visualize their data so they can see what they're contributing to research. They can kind of see along their pregnancy and track that information throughout their pregnancy. It provides some resources for them, but it's really a way to engage the pregnant and postpartum pregnancy population so we can learn about what makes a healthy pregnancy for everybody.
How interesting that they can, as you said, track and see what they're contributing. Because, certainly at Mother to Baby, we have our pregnancy studies and there's lots of different maternal health research opportunities. But one where you get some of that feedback, that sounds excellent and really interesting in my opinion.
Absolutely. This is a key kind of point of interest for me, right? So it also looks like we really want to get that diverse participant population. And I think it's so hard when you are a research participant, right? Like, what am I getting back? Obviously, there's that altruistic, hey, I'm contributing to make things better for everybody, but it's also kind of nice to know what's happening with the data that you're giving, and particularly when it comes to pregnancy and what's happening within your own body. I feel like we as moms can never get enough information. So why not allow you to see kind of what your data looks like, what we're looking at from the research side, allow you to see that information as well. We're not a health app or, give medical advice, but by really allowing you to kind of see your data and see what you're contributing, if something's going on with you and your baby that's kind of outside the quote unquote normal, it gives you a tool also to engage with the healthcare system. So really by participating, we want to make sure that we're giving something intrinsically back to our participants that can also help them out as well.
Such a great point. And let's take a half a step back just for a second. Why is maternal health research participation important, including having more diverse populations involved in that research?
Great question. So there's been a disparity in including pregnant women, actually really women in general, in clinical research. When you look at some of the most common conditions, heart disease, cancer, diabetes, you can see there's a kind of a inequity between who is suffering from these diseases, right? The proportion of women usually who are suffering from these diseases, and then how much participation, how much information we have about them that really drives how we provide care. So there's that disparity in general within women who participate in research, and then you compound that with pregnant participation, it's even worse, right? And then you look at those within the margins of our healthcare system, those who we really need to engage, those who suffer the most from healthcare disparities. I think, again, COVID-19 taught us so much about our healthcare system, but it really amplified the health disparities that we see. So again, when you look at those who are marginalized, those who are the margins of our healthcare system, there's an even greater disparity there. And the truth is, if we don't have information, if we don't have data, right, based on this population, we can't create clinical standards. We can't change health policy.
Right.
We can't change the way that care is provided at the bedside for the population. So the more information we have, the better we can be and the better care that we can provide.
I couldn't agree more. As an information specialist in a very niche area, I couldn't agree more that data is what helps us make these very important changes. So definitely applaud and appreciate the work that you and your team are doing.
Absolutely. It's definitely slow going, but it's important. We're passionate about it and we're not going to stop.
And speaking of COVID, certainly you're a parent, certainly you're a medical doctor. Can you share your experience with getting a COVID-19 vaccination?
Absolutely. So I think when I introduced myself and you asked about my kids, I have a 20-month-old. So I was pregnant with Kari, really kind of at the height of the pandemic. So she was born March of 2021. And in the winter, if you guys can remember, it was around November of 2020 that we started hearing about the COVID vaccine. So as a physician, we'll start there. As a physician, obviously, I'm in a healthcare setting. You kind of talked about it. So I was seeing really, really sick patients in the adult hospital. As an adult palliative care physician, I see the sickest of the sick in the adult. As a community pediatrician, I was in the hospital seeing sick kids. Also at that time, I was also doing home-based peds palliative care, so seeing sick kids in that population as well. And I'm just eager to get that protection, right, to make sure that, that I'm safe so I can continue taking care of patients. We're really excited for patients to get this vaccine that could hopefully turn the tide of this pandemic, because at this point, we're just getting hammered, particularly in the adult space and in the really sick kids that I take care of, right? Those are the most vulnerable. Right. So as a physician, I was excited. As a pregnant mom, I was terrified. Yeah. You and I both know that there just isn't enough information about what is safe, what is good, what pregnant people should be taking in general, right? And we have this new vaccine, and of course, pregnant people were excluded from the initial trials, right? So I had this decision to make. I'm pregnant. Do I get this vaccine? Pregnant women weren't included. What do I do? And it was terrifying. I had a group of other pregnant physicians, and we're talking to each other. So I'm like, well, I don't know what's going to happen. I'm not going to do it. And also being a Black woman, I know that there's a mistrust in the medical community around kind of what's safe and what's good. So because of my privilege, right, I'm able to access ACOG guidelines, ACOG recommendations before they even come out with my colleagues. And they said, actually, there are some women who didn't know that they're pregnant. We're getting some of these kind of safety profiles, and that it was going to be safe for pregnant women to actually have this vaccine, and it could help. And so I made the decision to get the vaccine in my first shot was January of 2021. And I went on social media and also just kind of posted me getting the vaccine, both shots, and then also kind of documented my pregnancy journey so that other women of color in particular would feel safe and comfortable getting this vaccine. That if I could just show that not only am I recommending it, but I'm also doing it, and here's what's happening to me. Here are my outcomes. I actually just put a lot of my medical history out there, which is very unusual for me. I'm a very private person, but it was too important not to, and people were just looking for information. So that was my experience as a doctor, and then also as a parent and a patient.
And so my guess is that you received some feedback about putting your story out there. Can you tell us a little bit about that?
Yes, I received overwhelming thank you and gratitude from, I was actually kind of nervous because I was on Twitter, and I've obviously never had more of a lurker on Twitter, and that post went viral. And it was actually a little bit intimidating for me to just see how many people were reposting and retweeting it and liking it, and the comments that I was getting. It was overwhelmingly supportive. And then, of course, there was the usual, misinformation bots out there who said, well, congratulations, you just signed your baby's death warrant. Let us know when your baby born with 3 heads or things like that. The comments I would get. And so my husband actually said, nope, we're just going to block these comments and you're okay. And so, but overwhelmingly support. And also, because I was in this medical space, my patients really appreciated it. So on the adult side, I take care of particularly actually all women with sickle cell disease, and encouraging them to get the vaccine. It made such a huge difference. I had my other colleagues saying, hey, I hope it's okay. I shared your post with my patients, and I was able to use that to get them to get the COVID vaccine. So it was pretty positive. And my OB at the time was like, I can't believe you're doing this, but I support you. And she was, just thrilled for me and with me, and was very supportive of that as well.
That sounds great. And as you said, having that representation out there in many different forms is helpful, and hopefully can ease people towards the decision, as you said, hopefully to get things under control. So I'm sure that that representation was more than needed. And it sounds like that it worked out in a mostly positive way.
Absolutely. It really was. And again, my 20-month-old is fantastic, high energy, did not have any problems breastfeeding, actually had a lot more milk supply with her than my first one. Everything was great.
That's awesome. My youngest was born actually right before we all knew globally about the pandemic. So in January of 2020. And I do remember, of course, when the first rumblings of the vaccine being available came out, and I had to stop and think, it's like, well, if I'm still breastfeeding at the time, is that something I'm going to get? And as you say, you have your one side of what your medical training is, what you know, and what is logical. And then just that gripping fear of, am I doing the right thing for myself and my family?
Absolutely. And I love the words gripping fear, because that's honestly what I felt, that uncertainty. Like, am I making a mistake? And I was able to kind of lose myself in the research and just kind of dive in. But there's that, there's the logical and there's the emotional. And I think being able to speak to the emotional when you're trying to educate a patient population, other moms, is so key, because a lot of it's so emotional, and being able to go there with them and talk with them at that level is so key.
Absolutely. And it continues to build that trust. And, I know sometimes some people hear emotional and think, sort of out of control with emotions, but emotions are part of most people's everyday life, and addressing it properly is another way to have that engagement.
100%.
So what was your experience like in the hospital?
Yeah, so I will tell you, actually, and it's a very happy ending with my 20-month-old. The pregnancy delivery was great because I had an OBGYN that I love and have a really good relationship and trust. And she was, again, still is one of my biggest advocates, and, helped me get in my own way. With my first daughter, it was not as smooth sailing. And I actually ended up changing OBGYNs. And I truly believe, actually, I know that had I not, I definitely would have been one of the statistics that we see when we talk about the maternal health care disparities. I was considered quote unquote geriatric when I had my first daughter at 36. Like, gotta love that term, by the way.
Oh my goodness.
And he just, it was a very, was it oh my gosh, you got pregnant? Because I was also told by this physician that I wouldn't be able to have kids because of my fibroids, et cetera, et cetera.
Mm-hmm.
And so when I got pregnant, he essentially made me feel like, well, this baby isn't gonna be viable, isn't gonna stay. And there wasn't that trust and that bonding, and anything that I wanted to do, there was no communication, there was no access, and he just wasn't listening to me at the end of the day.
Mm-hmm.
I'd ask questions about, because I was also traveling to Nigeria at that time during that first pregnancy. And he's like, oh, don't go. If you do this, your baby will die. Well, don't take this travel vaccine, because if you do, you're going to cause damage to your baby. And there wasn't it was more fear-based, and I didn't feel, because I knew I'm a pediatrician, so I know some things. I was like, actually, that's not true. And when I was having kind of this pain and I wasn't being heard, I realized, okay, this is time for me to switch OBGYNs.
Mm-hmm.
There was an incident when I was having significant pain during my second trimester with my first daughter. And at the time, my husband was home with our now 13-year-old, and the pain was excruciating. And I had switched OBs at that point to Dr. Bouet. I think she'd feel comfortable with me saying her name. And she had said, as you go through, you are going to have some pain. She prescribed me some Dilaudid to take, and I didn't want to take it. And I was really not going to take it. And the pain was so bad that I actually took a dose. Nothing happened. The pain was excruciating. This time it was like 2:00 in the morning. And so my husband had to stay with our son. So I ended up taking an Uber to the emergency room.
Oh my goodness.
And, I'm visibly pregnant.
Mm-hmm.
Nobody came to the car to help me out. It was the Uber driver who kind of walked me and got me a wheelchair, because I couldn't even really walk. The pain was so bad. And, the check-in nurse, seeing that I was visibly in pain, was more concerned about where I got the Dilaudid, that I was taking Dilaudid, than really addressing me and my pain and the help that I needed in that vulnerable state. And it was devastating. It wasn't until the person who comes around, checking insurance, who realized that I was a physician, because it was in the same healthcare system that I work at, that the demeanor of the physician, the nurse, that everybody changed at that point. Mm-hmm. And my husband told me, wear your badge. And I was like, nope, not going to do that. I'm going to go just like a regular person. And you can see where the disparities come from. The implicit bias, the way that you are trained, right? Our biases are based on our own upbringing, kind of what we see, but that bias impacts the care that's provided to you. And I will tell you, it was pretty devastating. And I think, actually, I know the clinical care team knew that it was bad, because the next day, I got a call from the physician, who then asked how I was doing afterwards. That's how bad the care that I received, really for the majority of that emergency room stay, was, until they realized what I did for a living and that I worked that healthcare system. So I can only imagine what really the majority of other pregnant people go through, right? Women of color who go through experiencing that situation. It was tough.
That sounds, wow, very powerful. I'm very happy that you and your family came through that. And I'm also very sorry that you or any other person needs to go through something like that in order to get your basic medical needs met.
Yeah. Thank you for saying that. And it's hard, because I hadn't talked about it. I mean, that happened in 2017. And it wasn't until I started really doing this work and with COVID that I actually ever spoke of that. My husband knew, and he wanted to, charge in. That's like, let it go. This is fine. I don't want to make waves, right? But until you learn that if you don't speak up, right, if you don't highlight what happens, then you can't help people get better, and you can't change a healthcare system. And I will say that experience definitely influenced how I conduct my clinical research,
Mm-hmm.
and why I put that emphasis on helping our participants have that data so they can also be seen and be listened to, and so that care can happen for them faster.
And we appreciate you sharing something so very, very personal. And as you say, it did happen a few years ago, but it doesn't mean that it's not incredibly hard to talk about in some cases. So again, absolutely. Thank you so much for that. So this is something, that I hear quite a lot in the various ways that I engage with the medical community. I'm a genetic counselor by trade. I work with doctors, pharmacists, and so on. So we know, of course, certainly, that healthcare providers have responsibilities to patients, and also on the other side that it can be helpful for patients themselves to advocate for their medical needs. And so thinking from that patient perspective, how can patients effectively be their own advocate?
I love that question so much. The CDC is launching a campaign, which I'm 100% behind. It's called the Hear Her. And the premise of this campaign, right, rather than just putting up the stats that, Black women are more than 3 times likely to die than white counterparts, et cetera, really every pregnant person goes through this and is at risk for these complications, right? The U.S. has the worst maternal outcomes of any developed nation. Mm-hmm. And so really every pregnant person needs to be aware of what the warning signs are. And so the CDC's Hear Her campaign really highlights that. It focuses on getting those symptoms out there so that it's accessible to any and all pregnant person to know kind of what those warning signs are, how to educate not just the mom who's going through the pregnancy, but who their significant others are, who their children, their friends are about those warning signs. And then it educates them, helps them advocate for themselves so they know what words to say when they do encounter the healthcare system. So they're aware of, okay, this is why I'm scared and this is why I'm here. This is what I'm worried about. So it does that education to help patients advocate for themselves. I would also add, though, that the other side that's missing is that then we on the healthcare provider side have to be able to listen to that. Yes. And hear them, right? So it's the patients can advocate for themselves as much as they can, but if we as healthcare providers are not doing our job in hearing them and being attentive to that, then the numbers aren't going to change.
I couldn't agree more. And I will say that in my own mind, I think about when we say things like, yes, patients have to advocate for themselves as a patient, as a parent, as a woman, and so forth. And I get that 100%, but I'm so glad you brought up that other perspective, because as a healthcare provider, there are responsibilities on that side as well. So hearing is one thing, listening is another, being able to do it and being willing to do it are also these other components. So I really appreciate just the emphasis of, in general, we should all be listening to each other, and especially when you're in a position to be helping people in any way. If possible, my suggestion is to try and listen, maybe even more than you talk.
Are you sure you're not a palliative care physician? That's literally our motto, right?
Nice.
It's more than we talk. That's exactly right.
Well, Dr. Ajayi, we are coming to the end of the podcast, but I don't want to let you go before you can tell us how we can find more information about PowerMom.
Thank you for asking about that. So obviously, I'll send you the website so you have it in your show notes if you can access to that. But for our listeners who are here, it's at PowerMom.scripps, SCRPPS.edu. So that's PowerMom, all one word, .scripps.edu, and you can join right from the palm of your hands.
Excellent. Dr. Ajayi, I cannot thank you enough for being here, highlighting issues that we don't typically talk about, but ones that we certainly need to put more of an emphasis on. So we are very grateful, and I would like to wish the very best to you and your family.
Thank you so much, and thank you for this opportunity. If I can, I would like to say that the data that we're collecting at PowerMom, right, our goal is truly to improve the way that healthcare is provided. And for that reason, we're not collecting data just to write peer-reviewed articles and things like that. We want to share this information with other people who are doing this research, other people who are able to impact this health outcomes. So we ask people to come join us become PowerMom partners, have access to this de-identified data so we can all make that difference that we hope to see.
What an excellent point. So if anyone is interested from that medical perspective for more information or any type of collaborative partnership, should they go to the PowerMom website?
They can, and there's a way to contact us directly. My email address is T as in Tommy, AJAYI@scripps.edu. Happy to be emailed too. But you can definitely go to the website. You'll reach me that way, or that's my email address. We're definitely looking for partners and collaborators.
Great. Thank you again so much.
I appreciate your time.
And that's all for this episode. As always, thank you so much for being part of our listening audience. If you have a question for the podcast, or if you want to be on the podcast, please feel free to email us at contactus@mothertobaby.org. Make sure that you subscribe to the Mother to Baby podcast. That way you never miss a new episode. And you can go back and listen to some of our older episodes as well. You can find us on iTunes, Spotify, or however you listen to your podcasts. And don't forget, Mother to Baby is also here to answer your questions about exposures before and during pregnancy, while breastfeeding, or in cases of adoption. You can reach us by phone at 866-626-6847, by text at 855-999-3525. You can also chat with us on our website, where you can also find our podcasts, but also our fact sheets and lots of other information. And our website is www.mothertobaby.org. So that's all for this time, but don't forget to tune in next time. And remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.